back to the Center for Neurology Educational Series. Today I will be discussing with you the role of CAT scans and MRI scans in neurology. A common question patients ask the doctor after doing a scan. Doctor, after you did my scan of the head, did you find a brain? Well, that's just a joke, but CAT scans and MRI scans are two different ways to image the brain. CAT scans stands for computerized tomography scans, while MRI scan is a magnetic resonance imaging scan. In the case of neurology, this imaging is usually of the central nervous system, that meaning the brain or the spinal cord. Prior to the age of CAT scan imaging in 1970s and MRI imaging of the 1980s, we only had X-rays and pneumoencephalogram to image the brain. The brain could not be adequately visualized. Angiography that allowed us to see the vessels of the brain and neck by giving a contrast dye into the arterial system was available. The arteries would light up with the contrast, just like the tree that lights up at Christmas time. Based on X-ray technology, CAT scan detects calcium well, and it allows us to see the bones clearly. CAT scans are good at detecting fractures and acute bleeding in the brain. However, strokes, while they can be seen on CAT scans, but not necessarily in the earliest phase. This is where MRI scan has an advantage over CAT scan. It can pick up strokes earlier than CAT scan. MRI scans detect changes in the water content of the structures, and hence can pick up white matter changes associated with stroke and multiple sclerosis better than CAT scan. There are technical differences between these two tests. CAT scans typically take 5 to 10 minutes of time, while MRI scans will take 30 to 40 minutes. There is noise in MRI scan, like some hammering is going on. CAT scan is mostly silent. Only your head goes into the machine for CAT scan, while MRI scan involves having the whole body into a tube. The latter is hence more claustrophobic. Both tests are painless and are very safe with rare exceptions. Being in an MRI scan for 45 minutes can cause some people neck pain. CAT scans do involve a small amount of radiation. MRI scans have no radiation. The dye with CAT scan is an iodinated dye and has more risk of an adverse or allergic reaction than MRI scan dye. MRI scan dye, also called gadolinium, is much safer in comparison, but it still has a slight nephrotoxicity, a potential for kidneys to be hurt. There are contraindications to MRI scans, such as having a pacemaker or a defibrillator. CAT scanning is relatively contraindicated in pregnancy when radiation exposure is totally undesired. There is a significant cost of these tests. The range is usually between $250 to $500. CAT scans should generally be cheaper than the comparable MRI scan in most facilities. In this day and age of the common saying, a picture says 1,000 words, we sometimes forget a picture is a picture and does not always necessarily indicate the function that lies inside. A normal CAT scan or MRI scan of the brain does not tell us, for instance, why someone is having migraines. Migraines are not diagnosed with a CAT scan or an MRI scan. For that matter, more than 95% of the imaging tests of the brain ordered in this country come back totally normal. Since doctors do not want to miss 1 in a billion chance, so we must be prepared to order a billion tests to pick up one lesion. We have developed an erroneous reliance on imaging studies to lull us into a false sense of safety. That is not to say that these scans are not necessary. However, their use should be judicious and be guided by a history and careful physical examination. I hope this information was of some help to you in understanding the role of CAT scans and MRI scans in the field of neurology. For further information, please visit centerforneurology.us.